the risk of uterine cancer with tamoxifen is a common concern that comes up. But I want to reassure you that the risk of uterine cancer is very low. I'm going to show you the statistics in a second from the American College of Obstetrics and Gynecology. They have a whole bulletin on this, so we'll look at that in a second. In addition, though, to the uterine cancer, what we do want to keep an eye on also is the risk of tamoxifen causing uterine thickening, so thickening of the uterine lining, or a risk of uterine polyps. Now, the guidelines don't routinely recommend surveillance pelvic ultrasounds in the absence of symptoms such as bleeding, but it's something that you do want to make sure that you're talking about both with your oncologist and your gynecologist and making sure that you're being followed. And here's where I feel very strongly that if you're on tamoxifen, you should be getting annual gynecologic exams and seeing your gynecologist annually. Now, you may not need a pap smear every year because pap smears are screening for cervical cancer. Tamoxifen does not impact the risk of cervical cancer, so we follow the routine guidelines for pap smear and cervical cancer screening, but you should be seeing your gynecologist regularly. Now, let's take a look at the bulletin. All right, so here we have some studies highlighted by ACOG, American College of Obstetrics and Gynecology. This looks at the National Surgical Adjuvant Breast and Bowel Project and the rate of uterine cancer, endometrial cancer occurrence among tamoxifen users who were taking 20 milligrams per day. So that is the standard dose. We do have a low dose for DCIS and atypium, but standard dose is 20 milligrams a day. It was 1.6 per 1,000 patient years. So that means if you have 1,000 women taking tamoxifen over 1 year, 1.6 women will develop uterine cancer. Another way to look at it is if you have 100 women taking tamoxifen over 10 years, again, 1.6 of them in that 100 will develop uterine cancer. So the risk is really, really low. It is higher, though, of course, than patients taking a placebo. So down here, you can see where they did an update. The risk actually of the uterine cancer was a little bit lower. It was 1.26 per 1,000 patient years compared to 1.6. So the risk is low. We do know that the longer you take tamoxifen, so if you go from 5 years to 10 years, the risk is going to go up slightly. And again, we're highlighting seeing your gynecologist, evaluating any abnormal symptoms. But we're balancing this very small risk of uterine cancer with the benefit of tamoxifen in reducing the risk of breast cancer recurrence and new breast cancers. Now, there are other side effects of tamoxifen. I'm just addressing the uterine risk here because that's something that came up. But let me know other questions you have about tamoxifen, and I'm happy to talk about some of the other side effects that we see.